kind of ashamed to admit that when I was younger, I remember this old lady walking down the street over in Timber Heights, over in the projects where I grew up. And unfortunately, I was not disciplined enough to know that I should have been more respectful. So we were just kind of jabbing at and teasing with the old lady. Then she looked at me and pointed her finger at me and told me, she said, just keep living. Well, at the time, I thought it was funny, but I don't think it's so funny now, because she told me just keep living. I understand that if you're going to keep living, then there are certain elements and certain happenings in your life that you need to be familiar with and things you need to do to try to take care of yourself. Now, one thing that helps you to keep living is your health. Health is very important and sometimes it's overlooked, particularly between and among minorities. So today, I am so fortunate to have Dr. Patrice Walker to talk to us about health in general, and minority health in particular, because this is National Minority Health Month. And before I turn it over to our very, very capable interviewee, I just want to kind of editorialize a little bit and say that, from a negative perspective, unfortunately, minorities lead the pack in almost every negative area. Income, education, maternity, health, diseases, you just name it. And then, unfortunately, minorities are at the top of the negative pack. But fortunately, there are things that can be done about it. And I think that's why Minority Health Month was conceptualized and implemented. So this is National Minority Health Month, and we're going to talk about it. But what we would like to do is to be intentional, instrumental, and effective in influencing, better and healthier living. And there are resources and information available to all of us that can be utilized to help us to live a healthier life and to help us with any kind of health problems that we are having if, in fact, we understand and identify those resources. And two of those resources are Atrium Health Center and Dr. Patrice Walker. So at this time, I'm going to turn it over to Dr. Walker to give a brief introduction of herself and just start talking about, health, what can be done, what is being done, what should be done, and some of the other information that ought to be revealed during National Minority Health Month. Dr. Walker?
Well, thank you so much, Mr. Havisham, my friend, for inviting me back to speak again. Whenever you call me, I'm always willing to come and talk to you because you are such an important figure in this community for getting information out to the people, which is half the battle, regardless of what the topic is. If I feel like I can contribute to it, I always will. So thank you for having me on to talk about National Minority Health Month, something that we recognize during the month of April every year, but really, every month should be National Minority Health Month because it is such an important aspect that affects, a lot of our lives. We have a growing percentage or proportion of the population in the United States that is minority. And so as that population continues to grow, I think we will have more and more focus on the issues that affect that population. And so health, of course, is one of the big issues but you listed, a number of things that seem to negatively, affect minorities, and all of those things that you just listed are related. Many people don't understand that, but we have an entire I don't know if I should use the word philosophy, but it is a known entity, what we call the social determinants of health. That
Mm.
should be a phrase that many people are probably familiar with. Maybe you've heard them called the social influencers of health. Same thing. We understand that a lot of the things that ultimately affect our health are impacted, driven, and determined by social factors, like what you just listed, like our education, our employment status, where we live, and the list goes on and on. And I think that the number one thing that I want people to understand or know and realize is that until we solve for a lot of those social factors, we're going to struggle to improve the health of the minority community because they're that closely. And finally, the Centers for Medicaid and Medicare Services, or CMS, is really getting hip to that. They are really understanding that, and so they are really forcing the medical community to do something about that. And I say forcing, but at Atrium Health Navicent, we have been working in trying to improve some of the disparities, but now we have an additional reason because starting in January 1 of this year, of 2024, CMS is requiring us to screen all patients that come into our hospital. They come in and they get admitted as an inpatient to the hospital. We have to screen them for social determinants of health. And that's every time you get admitted. So if you come to the hospital and you get admitted multiple times, which hopefully you don't, but there are some people that have, conditions that do have to get admitted multiple times. And so every single time you get admitted, we have to screen for that. And then in our primary care clinics and our specialty clinics, so when you go to the doctor out in the community, we also are required to screen at least once a year in the ambulatory setting. So, and that's not unique to just Atrium Health Navicent. That is, if you provide care to a patient or a client and you get paid by CMS, that requirement applies to you. And so what that means is that probably people are being screened as they're going to the various, health facilities and going to the various doctors. They're probably going, why are they asking all these questions all of a sudden? And it is based on that. The CMS says we need to screen for those things so that we can understand what is it that impacts my patient after they leave away from my clinic or before they come here. And if we understand some of those limitations, then hopefully we can help them create plans that will help them take better care of themselves, or we can help ensure that when they do get discharged from the hospital, they're not going to come right back, not because we didn't give them good care, but because some of the things that they need, to do and get medications and things, they're not able to get those things because of the various, those various factors. And it's not always even medication. It could be food. We have some people live in food deserts where they don't have access to healthy food. I mean, any number of things. So we now have the ability to screen. It's a questionnaire that we ask patients. And then if someone screens positive, we have a tool that we can put in their zip code. We put in the patient's zip code and we put in what their needs are, and it gives a list of potential resources that are within a certain radius of where that patient lives.
Wow.
Because half the battle is identifying, what the need is. The other of the battle is, well, now how do we help fix this need? And it's all fine and good to have a resource in Macon, but if the patient doesn't live in Macon, that's not very helpful. So this resource that we have actually ensures that wherever a patient lives, they have access to at least it may just be information, depending on what it is that they need. It may not be the physical item, but it's something that can help them, fill that gap. So I am very, very excited about this move in the right direction. This is certainly not going to get us all the way there, but things like this really are going to change the landscape of healthcare and how we take care of this community.
Well, I think it's oftentimes overlooked how all of these things tie together as it relates to healthcare. A lot of people probably have not thought about, where you work, where you live, whether you got a savings account, your family history, your neighborhood, your education, and I might be repetitive, but I think what the premise of it is that there are peripheral effects, you know, peripheral factors that affect one's health. So, and I'm glad you mentioned it because we may not think about it. Oftentimes when one has a problem, we tend to think that that problem is just in a particular area, not realizing the influence and the impact of other surrounding factors that may influence that problem. The other thing that I'm glad that you mentioned is, and look, Doc, I preach this all the time, and I just try to create and improve conscientiousness, if you please, about all of the resources that are available in the community. I teach a couple of life skills classes and what have you. Matter of fact, I work with a guy who 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 tries to get Roger Jackson, who tries to get people who probably have been forgotten or underserved or what have you, or got a criminal record or other kinds of problems, and they're despondent and they think that they can't get a job. But he's initiated a program called the Adult Readiness Program, where we go in and teach them blah blah blah. But the point I'm trying to make is one thing I tell them is that irrespective of your situation, or whatever situation you find yourself, before you become too despondent, think to yourself, now, I wonder if there's a resource out there that can help or assist me or provide support of information for my situation. So I'm so glad that you all are using the resource element. A lot of people probably didn't think about it. They go to the hospital sick and then they think it's just that illness. But I think what you're saying is that there are factors that contribute to that illness. Is that right?
I think a great example is something like diabetes, which is very rampant in the African American community. And diabetes is one of those diseases that sometimes you can have for quite a while and not know it. And then when you do get diagnosed with it, it can be really life altering. But part of managing diabetes is treating it with medication, perhaps. Sometimes you don't necessarily have to treat it with medication. Sometimes it takes lifestyle modifications like, doing exercise and whatnot. But the other big part of diabetes is what you eat. Big part of diabetes is what you eat. And we like what we like. That's part of it. Is some of us can afford, to have very healthy diets, and we choose not to. So that's one thing. But there are others that truly have very limited finances, and those limited finances mean that they're going to go to the grocery store, or the not even the grocery store, because they may not be, have access to a grocery store. So they may go to the Dollar General, which has lots of food in it, but a lot of that food is processed food and foods that are not necessarily going to be what you should be eating if you are a diabetic or have any other number of chronic conditions like high blood pressure, And so, but when you have to decide, well, do I pay the light bill, or do I, spend this money on fresh fruits and vegetables? That's the decision that you're going to pay the light bill, and then whatever you have left over, you're going to have to try to make it stretch. And so that means that um, when it comes to making those choices, but having fresh food and things like that, that's expensive. But you can get some ramen noodles, for pretty cheap, or you can get some Vienna sausages, or you can get, so the things that are cheap and are not always the things that are good for us. And so it all works together. So then you show up to the doctor and your blood sugars are sky high, or and you're like, well, I'm doing the best I can, right? And so all of those things work together. It's not necessarily that people are not wanting to do better. They are in circumstances that make it very difficult to do the right thing. And I think that's one thing that we have to consider. And how do we help people, improve those circumstances so they're able to make better decisions and afford, the types of foods, and what can we do until they are able to do that? We now have the food bank, the Atrium Health Navicent food bank, where a physician can write uh, a the food pharmacy. We call it a food pharmacy. A physician can write a prescription for fresh fruits and vegetables, and that patient can bring that prescription into the food bank, the food pharmacy, and they can have that prescription filled. And so, resources like that, I think, are very important to bridge that gap between, for the patients that want to do the best thing for their health, but they're not able to do that right now.
Yeah, and then sometimes we overlook, unfortunately, the importance of being conscientious about health, the importance of resources that are available, that would help with health, the plentifulness, if you please, of programs, and initiatives that are available to kind of assist and educate us as it relates to how we live and how healthy we are and the quality of life. And it just takes an ever-present conscientiousness, and then I mean, you are what you eat. I've heard that a lot of times, and sometimes, Doc, when I'm at restaurants, you know, I get a little envious, really. I see these thin men with no gut, you know what I'm saying? The pants look good on them and the shirt stays tucked in. And I look over at him, I said, wow, look at that physique. But then when I look at his plate, he got grilled chicken and vegetables and no bread and no dessert. So I think it's important that we kind of look at health holistically and consider all of the factors that influence our health and how healthy we are. So talk a little bit more, if you would, about maybe some of the programs that are available, maybe the specific, because I know you all got clinics and just all kinds of activities and programs at Atrium Health designed specifically to assist people. I know you already talked about, how you try to do the survey and try to find out all of some of the other factors that may influence why that person is suffering from the ailment that he or she is suffering from, and what are some of the factors. But what other kind of programs would you like to mention that are available? Since this is National Minority Health Month, and since I said, I guess I'm gonna do another quick introduction. This is a call to action. I'm your host, Alex Habersham, interviewing Dr. Patrice Walker, Chief Medical Officer. Is that correct?
That's correct.
Yeah, Chief Medical Officer for Atrium Navicent Health. So, what are some of the other programs out?
Sure. We have an entire department that is called Healthy Communities. And Healthy Communities is our community facing department that is outside of the walls of the hospital. We want to try to, believe it or not, we want people to not come to the hospital, of
Right.
course. We want them to come to the hospital when they're sick, and you have options. You don't, but we want you to choose hospital when you need hospitalization. But honestly, we would like for our community to be as healthy as it possibly can. And so the Healthy Communities team is actually out in the community ensuring that people are educated, informed, and supported in a way that keeps them healthy and out of the hospital. And so the Healthy Communities team is really the people that are most likely to be seen at various health fairs, and they're the ones that are going to be out checking blood pressures and handing out brochures about all of the things that we do. But they also include community health workers that can literally go to people's homes and help them in their homes with things like medication planning. People take a lot of medications, and sometimes it can be difficult to keep them straight, and what am I taking today, and whatnot. And so we actually have resources that can go out into the community and help individuals. There are also several clinics that are specific to chronic diseases. I mentioned diabetes. We have diabetes healthways, which are is an education arm. So when people are newly diagnosed to diabetes and don't really understand, it can be very complex. And many times the doctor's offices don't have time to sit down with you and spend the amount of time that needs to be taken to really make sure that every patient understands the unique things about diabetes for them. So we have a program where you can get referred to diabetes healthways, and those are nurses and other educators who can spend the time, to sit down and make sure that someone who has a diagnosis of diabetes, doesn't even have to be a new diagnosis. I said new diagnosis, but it doesn't have to be a new diagnosis. But to make sure that you understand, what that means for you, and understand exactly how you should take medication, or if you're on insulin, they talk to you about your diet and what to eat and how to eat it. And that's just, those are just a couple of resources that we have within that, Healthy Communities umbrella. Congestive heart failure is another thing that affects the community a lot. And so we have a congestive heart failure clinic that you can receive care at, that also has an arm that can do some home visits, and talk to patients about the importance of weighing themselves and checking their blood pressure. And again, diet. What are they eating? So I keep harping a lot on food because I mean food affects so many things and medical conditions, that if there's one thing that I think we could do a whole lot better with, it is food. A lot of times people think, well, I just need to exercise. If I could exercise, I would be healthier. But you know what? It's hard to out exercise a bad diet. So I really think we need to sort of change the way that we think about our relationship with food. That's not to say you shouldn't exercise. I'm not saying that, but the attention that you pay to food is just, if not more important than that exercise component.
Another thing, since this is National Minority Health Month, that I've heard a lot of talk about is minorities and hypertension. Now I guess that's high blood pressure, I guess.
That is high blood pressure. Yeah.
Talk a little bit about that, what it is, and maybe, some ways that it can be prevented.
Absolutely. So high blood pressure, I said that diabetes, sometimes people can have that for a long time and not know, but hypertension or high blood pressure is really, the silent killer, because you can walk around for many, many years and
Right.
have high blood pressure and not have any symptoms, not necessarily feel bad. Some people have symptoms, but many people don't. And they don't know it until it has already caused damage their kidneys and whatnot. And so that is why it's so important to have a regular physician that you can go and get your annual screenings and make sure that you don't have hypertension, because it's not always something that you would know that you have. And so, you can buy a blood pressure cup over the counter these days. So you don't necessarily have to go to the doctor to get your blood pressure checked, but you still need to have a primary care physician. And so everyone should be checking their blood pressure, especially if you know you have a history of it in your family, your mother, your father, or siblings. And it is linked to so many other things that can cause um, poor health, cardiovascular disease and stroke. Stroke, we're in the stroke belt, and high blood pressure is directly linked to stroke. So that really is important for everyone to be screened. And if you have it, to make sure that you're getting treated and taking it very seriously.
Wow. Well, that's extremely important. And the long and short of this conversation is that, and we saying this is Minority Health Month, but Dr. Walker said every month is Minority Health Month.
That's
And
right.
the other points that we're trying to make is that health is important, and then it influences every walk of life. And we're also saying the converse, every walk of life influences health. And so, and then thirdly, what we're saying is that there are resources available for all of us. You can, just go to atriumhealth.org or whatever the Atrium Navicent Health website is. And I'm sure that they've got all kinds of information on there. And then if you're not sure, then you can just call me, at 478-464-0074. And I just learned this the other day, Doc. You can call 211. 211 is a program operated by United Way. And it too, is a resource bank. And when people call, they can refer them to different community resources throughout the community, 211. But the long and short of it all is that, health measurably influences the quality of life. And we all want to live a long time, and we don't want to live a sick life, and we want to live a good life. And so we all need to be more conscientious about our health. Dr. Walker, I am so appreciative, as always, of your coming on the show and your imparting valuable information as it relates to not only Minority Health Month, which is every month of the year, but also as it relates to many of the factors and the influences and the importance of our health. And, it just benefits you, it benefits your family, and it benefits the community, because a healthy community is a happy community. So it behooves all of us to try to be very, very healthy. This is a call to action. I'm your host, Alex Habersham, having interviewed Dr. Patrice Walker, Chief Medical Officer for Atrium Navicent Health. Look up the resources and utilize them. Have a great day.
www.makingblackpages.com